I am Max Fried, Doctor of Acupuncture and Oriental Medicine. Today we're going to do one of my favorite parts of QiGong. It is based off the 12 meridians. These movements were found thousands and thousands and thousands. They're some of the oldest movements in QiGong, which already is a very old martial art, going thousands of years back. And these movements were found with paintings on caves, and that's where they got these movements from. And these follow the same meridians that we do in acupuncture and acupressure and in today's Chinese medicine. So when we do these movements, we're actually doing our own treatment for whatever system it is. And there are 6 yin organs who each have a meridian, a channel of energy, a channel of qi that flows through it. And then there are 6 yang. The yin are the female, the yang are the male, and they're actually paired up like husband and wife, which you learn in China when you learn Chinese medicine. But these are the 12 meridians, and you're going to learn today the pairings because we're going to do them by element. So these are called Ma Wang Dui Dao Yin, the 12 meridian set. Okay, and so let's start off. We're going to start with the metal element. There's 5 elements in Chinese medicine, and the first element is the metal element. The metal element is the lung and large intestine. And what's interesting about people that have a good metal element, they tend to be very charismatic. They're good at leadership, typically. They have strong immune system, strong endurance, and they're able to take new things in easily, and they're able to let go of things they don't need easily. So if you think of what the large intestine and lung do, they're constantly taking new energy in and letting go of things we don't need, right? When we inhale and exhale, and when we absorb nutrient and then defecate, right, with the large bowel. So these will help benefit the lung and the large intestine greatly if you do these a few times a week. Your large intestine and lung function will be quite improved if you do this regularly. So most of these are done from shoulder width apart. And so we're going to start neck stretched up, chin slightly tucked, shoulders down, pelvic tuck, chest slightly concave, which you feel going into your core. We're sinking into our heels, very gently grabbing the toes so the weight is even on our feet. And we want to have our chest just slightly concave with our shoulders rounded a little bit. And that concavity you feel going into your core. So you have very good center of gravity. We're even on our feet. And when in doubt, because there's a lot to the posture, just stand straight and relaxed, right? And so from here, we're going to start with the lung. We're going to bring our hands to our chest, and we inhale and exhale. Inhale and exhale. You can sit a little bit when we exhale. Now I'm going to ground into my right heel as my left foot turns, and I'm going to present as I inhale. My back heel comes up, and from here I exhale as I come back. My foot will be 45. I exhale. This is called draw the bow. I want to feel qi when I exhale go from my chest to my thumb. That's the lung channel. So as I go here, I'll exhale, and I want to feel that qi. Right from here, notice I'm bent forward just a little bit here on this one. And then I'm going to come here, and we're going to go the other way. First inhale, and exhale. Just feel that qi between your hands. Inhale, almost like pumping the lungs. Exhale, and as we exhale, we lean on the left stool, turn, present, inhale. And then exhale, feel that from the chest to the lung, to the thumb. Keep shoulders low, very straight. I lean forward just a little and come here. And that is the lung. We'll do it one more time with no talking. Come here. So that is the lung meridian. The husband of the lung is the large intestine, and so these two make up the metal element. And for the large intestine, this is called stretching the back. What we're going to do is we start similar from here. We're going to rotate our shoulders forward. As we come up behind us, we inhale, and I start to lean forward. My shoulders rotate inward. The back of my hands face each other, and I flatten my back here. And just for a second, relax with your back flat. Now I'm going to slowly come up at a little angle, and I want to feel, this is called cat stretch. Feel the mid and upper back stretching between my shoulder blades, between my scapula, and I inhale, and I'm going to gently come up. We're going to sink onto our right stool, hands about rib level, and we're going to massage the ribs. And now the weight's going to come to the front, the back of the hands touching. As I come back, 45-degree angle I'm going to inhale. And with the lung, we lean forward. With this, we don't lean forward. Our head might go a little bit forward. What we want to feel is someone pulling our hands. So our back will hunch. My head will go a little forward, but I'm not leaning forward. So here I stay straight, just hunch, as if someone's pulling my hands. I inhale. And then I exhale, push, and neck up, push down. And then I come here. Let's do that again, the other way. From here, inhale. And back of the hands together here to flat. I come up, inhale. Cat stretch, the mid and upper back between the scapula. Inhale. Sit on that stool on the left, hands at the ribs. I bring the weight to the front foot, massage the ribs, come around, and inhale. As if someone's pulling my arms, I hunch the back, but I don't lean forward. I stay straight. You see that? And then push up with my neck, and that is the large intestine. The next is we're going to do the earth element. This is the spleen and stomach. The spleen and stomach is where we get a lot of our energy from. It's where we absorb our nutrients, our minerals, our vitamins, our protein into our bloodstream. So the spleen and stomach produce qi, our life force energy from our food. It produces blood, the nourishment that's going through the blood system, right? And it produces something called body fluids, which are very important, that you learn when you're in Chinese medicine. So the spleen and stomach are super, super important. Also, there are digestive organs. We get rid of things we don't need. The spleen controls the muscles. So the stronger your spleen, the better your muscle tone, the better your metabolism. When people have hypothyroid, that's very similar to spleen weakness, or what we call spleen qi deficiency. And for patients that I have with hypothyroid, I tonify their spleen, and they have great results with their thyroid issues. They also should see a doctor to check their thyroxine levels and all that. But for the most part, if you tonify spleen, they do so much better. And so also we drain damp with the spleen, which means we get rid of fat. So the spleen are the outer core muscles, the inner quad muscles. The stomach are the outer quad muscles and the inner ab muscles, right? And it goes all the way down into our feet. So if you have strong legs and strong core, it really helps the energy of your spleen and stomach, and vice versa. So these movements are great ways to increase the energy and vitality, strength, and function of your digestive organs. It also will get you in good shape. So the first one is spleen. It's called dragonflies. And basically, we're going to keep our feet pointed outward a little bit, about 45 degrees. And instead of being totally close together, that's quite difficult and more advanced. But for most of us, we're going to want to have a little bit of a separation here. And so from here, we're going to bring our hands to the solar plex. We're going to massage the rib, the right below this where the rib meets right here. We're going to massage, and if you can, you push in. There's a point right here called spleen 21. Very good point. Push in. If you can't, don't worry. Just do your best. And then we're going to massage down the outer ab. Keep good posture. Pelvic tuck, neck up. The outer abs through the groin. This is all the spleen channel. As we come down, if you want to, for those of you who have knee problems or who are less athletic, you can stop right here. This is spleen 10, and you can make a little lotus and then come up. For those of you that are a little more athletic, you can saw down all the way down into this position. But I don't want you to lean forward like this. I want you to keep your posture as you go down. And if you can't, I'd rather you stay higher, and gradually you'll get lower and lower, okay? So we're going to start here, feet out. We're going to saw down the outer abs through the groin and go as low as you're comfortable. Keep that posture. You might lean it a little bit forward, but don't lose that posture, that structure. From here, we make a lotus and we come up. Inhale. And as I bring my hands up, I'm going to point them outward as I lift off the floor with my heels. Inhale. And then I'm going to bring them back as I come down. Exhale. Let's do that one more time. To the solar plexus, I flip. Inhale. Push in on the ribs. Saw the ribs. Saw the outer abs. Saw the adductors. Down the spleen highway. All the way. Lotus position. Inhale. Bring hands up. Point out. Bring the heels up. And exhale. That's dragonflies, which gets the spleen very strong. Notice the spleen and stomach exercises get the legs very strong and they get the core very strong, right? So this one is for the stomach. It's called duck swimming across the pond. And so here we want to keep our knees together. Some of these we start with our knees together. So for the stomach meridian, again, you're going to get very strong core and very strong legs. Knees squeeze together, pelvic tuck, neck up like always, only now our knees are together. And from here, we're going to sink into our right stool, and we'll bring our hands up. Notice this, my weight is all into my right side here. I'm in control as I step forward. My hands come up, and I inhale. Keep the shoulders low, like imagine a duck going across a pond. As I bring my weight to the left heel, keep that pelvic tuck, and I'm inhaling. And then I exhale when I get here. I throw my hands back, and I look the opposite way and bring my hips the opposite way. And I exhale. I want to feel this maximum twist, and this really strengthens all these muscles here. And then I'm going to sit a little and look like I have a ball here. And I'm going to come around as I sink a little into my heels. I'm inhaling, come all the way around. Here I want to get this nice stretch here. So I really feel that stretch. Inhaling, up, and then exhale. Keep those knees together. Let's go the other way. Now I'm going to sink into my left. Inhale. I'm going to bring this, and as I bring the knee together, I throw my hands back and twist my hips and my head, and I exhale here. Feel that core strengthening here. And then I sit, look at my ball, good posture. Inhale. Bring it around. Get that good stretch here. Inhale. And down. We'll do one more time each way, okay? Without much talking. Inhale. Exhale. Inhale. exhale. Feel that twist. Inhale. And that's the earth element. So that's spleen and stomach. The next is we've done metal element, we've done the earth element, and now we're going to do the fire element. The fire element actually has primary fire and secondary fire. So in the primary fire, we're going to have the heart, which is the yin, and the small intestine, which is its husband, the yang. And so let's start with the heart meridian. This is called bird spreads its wings, shoulder width apart, hands here, and we're going to notice my hands are slightly pointed in and down, shoulders down, neck up. From here, I'm going to inhale as I bring my hands here, lean back a little, inhale, come behind me, and I exhale as I bring my hands forward. I just come to where I'm flat and I relax. And then I'm going to push down and look up. From here, I want to go here so you can see my back. I'm going to hunch just my lower back, then my middle back, then my upper back, and then I come down, look forward again. And then I'm going to curl up again, and that's it. Let's do it one more time, and I'm going to stay straight this time. So from here, we're going to bring our hands this way, pushing down, fingers up, pointed in just a little. I'm going to come around, inhale, hands behind me, exhale as I come down, very relaxed, and just go to where my back is flat, and exhale. Inhale, and I'm going to exhale again and push down and look up. Right? Go to where you're comfortable. From here, I'm going to curl my low back, hunching my low back up, then my middle, then my upper, and I'm going to come down again. This is great for the spine. Then I'm just going to curl up, relax. So our spine is like a snake. This is incredible. Our spine is the superhighway of our nervous system. So when we can move it this way, it's phenomenal to keep things moving the right way through the spine. That's where all our nerves come from. So spine health is very important. That movement is fantastic. And next is the small intestine. So for small intestine, we're going to start with our knees together. Small intestine meridian goes from our pinky all the way up to the back of the neck into the ear. So you're going to feel all this. This is where people get tons of shoulder neck problems, right? So this is incredible for the shoulder and neck if you do this correctly. It's also very good for the core and legs. This is called stretching the abdomen. So knees together, the small intestine. And we're going to start with our hands up here, shoulder width, neck up, pelvic tuck. From here, I'm going to turn my hips one way as my right hand will turn up. This shoulder has to be low, my neck up. That way I get that nice stretch. I get this beautiful stretch here. If I keep it like that, I don't. If I keep it down and twisted and neck up, you really feel that stretch. And then I'm going to turn this way. And we do this twice. Low shoulder, boom, boom. We do that twice. And then the left hand's going to come up. I sink a little. Right hand in. And keep the knees together. I push up and push down. This is going to be slightly pointed that way. And I'm going to put a little more weight on my right. And I'm going to turn a little. And then I'm going to come to center, left hand inside, push up, put a little more weight on my left. I'm going to turn a little, keep the knees together. Helps your adductors too, all right? Let's do it one more time. Small intestine from here. We're going to inhale and exhale. Inhale. Notice that stretch, exhale. Keep that shoulder low, neck up. And then we're going to inhale, sink a little. Keep my weight on the right heel a little, knees together as I twist. Push up, feel that all through your abs. From here. And then weight on the left, turn. And that's the small intestine. So that's primary fire. Now let's do secondary fire. So secondary fire is the pericardium, which is like the protector, the bodyguard of the heart. Pericardium goes from the chest all the way down the arm. So for people who have all kinds of carpal tunnel, brachioradialis tendonitis, which is very hard to get rid of, all kind of shoulder, anterior shoulder, this is amazing for any kind of pain along kind of the radial nerve and a lot of other things that go this way and that way. It's amazing for pain or stiffness through this area. So the pericardium, keep your knees together. Bring your hands up, kind of like small intestine. We're going to bring our left hand up and just see how my torso kind of leans. Then I'm going to look at the other hand. And from here, I'm going to sit a little more and stretch a little more. I want to reach with my middle finger all the way. Feel that shoulder, neck up, shoulder low. This is an amazing stretch right through here. And then I'm going to come up. And then this one flips. This one flips. I'm going to turn this way. Here, knees together. I'm going to sink a little. Keep my posture good, my neck good. Turn and stretch. Feel that stretch going all the way through there. Then I'm going to sink a little more and stretch a little more. You'll feel this amazing stretch going through there. Let's do one more time each way. Stretch with that middle finger. Sink. Stretch. Sink a little more. Reach a little more. That's the pericardium. The Sanjiao is the yang meridian in the secondary fire, okay? The Sanjiao, you can start a good shoulder width apart. On this one, we might even want to be a little bit wider than shoulder width, whatever you're comfortable. So, so here's the Sanjiao. Again, go as low as you're comfortable. If you don't go as low as I do, that's okay. Go as low as you're comfortable. If your knees hurt, don't do it. Go lower, right? Anything that's hurting you and making it worse, don't do it, okay? Or seek more instruction. So this is the Sanjiao meridian. And the Sanjiao kind of does everything. Remember, it's upper middle, so there's a lot to it. Basically from here, shoulder width or slightly more than shoulder width, what we're going to do is we're going to sink into our right heel and turn like we've done in others. From here, I'm going to look straight ahead. As I bring my weight to the front, I'm going to bring both hands up. And from here, I'm going to stay looking that way. As I come down, my shoulder's going to go down, then elbow, and then wrist, kind of like a bird. And I'm going to sink, good posture, as low as I'm comfortable. As I come up, I look to the center. And then I'm going to come down. On this one, my elbows come to my side here. And as I come up, I'm going to turn and look to the back now. My fingers are pointed up, shoulders down, thumbs in an L, and then I'm just going to come around. Now we're going to sink, and we'll go the other way. We sink into our left. I'm looking forward, coming up. Inhale. And exhale, shoulder low, elbow low, hands low. Stay looking to the center. As I come up, I look front. And then I come down again. This time, just bring the elbows in. And as I push up, I look to the opposite side. Push my hands out, thumbs up, shoulders down, and come around. Let's do that one more time. So the Sanjiao, we're going to start like this. And come around. Now we're going to go this way, sink into our left. Make sure you look center. Come up, inhale. Make sure that shoulder is low as you go. Good posture. And push. Come around. So that's secondary fire, pericardium and Sanjiao. The last two are, let's do the water element. Very, very important. This is the kidney and the bladder. The kidney, so important for so many things. I'm not going to go into it all now, but the kidney is a major energy storage center. The dantian is a thumb or two width below the belly button. This area here is the center of everything. It's where our kidney grasps the chi. This is how we begin breathing. So when we inhale, we grasp the chi with our kidney energy, and it starts from here. So if this area is relaxed, we're relaxed. Our digestion's better, our mental, spiritual health, we're more calm, and we get all kind of benefits health-wise when our dantian's relaxed and we're breathing calmly. When this area is strong, this is what's known as the core, right? It goes all the way around. The core is the center of everything in athletics. So the stronger our core is, the more athletic and young we are. The more calm this area is, the more calm we are, the more aware we are, the more we enjoy life, and less stress, less fear, more health benefit, less chance of disease, and yada yada. So let's start with the kidney. And so the kidney, you saw something like this. If you watched the 8 Brocade video, you saw a similar movement, but slightly different here. Remember, the kidneys they go all the way, they're inside here and here, and they're inside here and here. Anything that twists is really good. The kidneys like to be massaged and twisted. It helps them to function better. So that's kind of what the kidneys do on their own anyways. So from here, we're going to start shoulder width, good posture, neck stretched up, pelvic tuck, concave, going into our core, fingers reaching down, knees slightly bent. And from here, we're going to bring our hands to here and massage around to the back as we push forward. We've seen similar movement in 8 Brocade. Inhale, and then as I come down, I'm going to slide down the side. Exhale. From here, I'm going to let my hands just hang as I want to feel this relaxation here. My shoulders real relaxed, my back flat. And from here, what I'm going to do is I'm going to use my low back muscle. I'm going to turn and look over my left shoulder. I'm going to use my left low abs and back here to turn and look up. So the right hand will just hang, but I'm not using my shoulder to turn. I'm using my core to turn here, my low back. Inhale. Inhale and bring all that chi into your kidneys. And then exhale. And then I slowly come up the kidney highway here, up the inner leg. And I'm going to bring my hands up to here and back down. And then let's do it again. Inhale as I push forward. Exhale as I massage down the sides. And I'm just going to feel my back flatten here. This time we're going to go to the right. So I'm just going to keep my body very straight, like my back flat. I'm just going to turn from my low back. My shoulders very relaxed. I'm going to look over my right and inhale. Breathe into my kidney. Feel that twist. And then exhale. Very good. And come up. We'll do one more time, okay? Come up. And here, inhale. And exhale. And then inhale. Come up. And from here, inhale. And exhale. We can go up the right this time. Remember, use your low back, not your shoulders to turn. And then I come up. And that's the kidney channel. Okay, bladder channel. This is called the bird's beak. So the kidney channel, this one, there's a modification. It's a little bit more difficult than some of the others. So here we're going to start shoulder width, sink into our right. Our shoulders are going to rotate this way. Notice my knee here is not in. It stays out, right? Whenever I sink and turn, that knee stays out. It doesn't go in. And from here, I'm going to rotate my shoulders forward, bring my weight onto the front, and make a bird's beak. The thumb touches the tips of the fingers. So from here, then I'm going to come back 45 degrees this foot. I'm going to come back, make a bird's beak. And then I breathe in, come up, and this may take some practice. You're going to bring this up and forward. Point the foot forward. And as I bring the heel forward, my hands come back. And then here, and then back. So don't be too intimidated. I'm going to show you a little modification. So we're going to go this way, make bird's beak, come back. This foot's 45. If you want, you can go like this and touch here. And then you can bring it this way. Notice my hands, my feet, and this way. Let's do it one more time both ways. So from here, we're going to rotate, come forward, inhale, and then we come up, forward, inhale, bring the hands back, exhale, and come down. Let's do the other way, sink into this. Notice the knees out, exhale, inhale, and come up, exhale, inhale, exhale, and come forward, okay? Remember, when you go forward, if you want to at first, you can come to here. It's easier for balance, okay? So that's the bladder channel. And that leaves us, that's the water element, okay? The last one is the wood element, which is the liver and gallbladder. So let's go through those. So the liver, the emotional soul, the hun. And remember, all these pairs work together. So if you have a lot of stress, you get to keep your liver chi moving. That's what causes, when we have stress, our liver chi gets stuck. When our liver chi gets stuck, it causes stress. So if we keep our chi moving, the liver controls the sinews. So that's the ligaments, the tendons, the joints. So anything we do that helps chi flow through our joints helps the liver. Also, as we do these movements, we do a lot with our eyes. We follow things with our eyes. It's very good. You can even do QiGong for the eyes, but we're not going to get into that. But anything that benefits the eyes benefits the liver, and vice versa. The liver opens the eyes. The liver blood nourishes the eyes. So it's very important to get enough sleep so that you restore your liver blood. If you get a good 8 hours of sleep, if not, you don't restore and that hurts your eyes. It hurts your brain. Okay, also hurts your liver. And it's important not to eat a bunch of toxic chemicals and crappy food and junk food and candy and alcohol, because that will clog up our liver chi too. Also, it's important to work on our relationships and to try to stay calm with work. With work, life planning, relationship stress, family things, all that kind of stress can burden our liver chi and clog it up, and that's the beginning of many disease problems. So if we keep our chi smooth by staying calm, breathing, if you have to meditate, exercise is so good. Stretching is particularly good for the liver because it gets things moving through the joints. And so the liver, this is the liver meridian. So we're going to start shoulder width apart like we have on every other one. We're going to sink into our right so that our weight's on the right. I'm going to bring this foot. Notice my weight is fully here. You'll get, as you practice QiGong more and more, At first, you'll feel real awkward and out of balance. You'll be like, man, this is so hard. Just practice. Don't worry about it. You'll be surprised how quickly you start to get it. It's kind of, if you do a little bit every day, you'll be surprised how quickly you improve. And stretching too, if you're like so tight, like, I can't do it there. Just keep at it. Go at your pace and you'll get there, I promise you. And you'll get tons of benefits while you're doing it. And it feels good. QiGong feels good to do. So liver. The liver, we're going to be here. We're going to sink onto our stool and just take a step. And as I bring my weight to the left, my right hand comes up. My left hand points down. So I'm reaching with one up, reaching with one down. And I inhale. And then I'll bring this hand around and come back onto this foot and this way. And then I'm going to sink into the left and take a step. Now my left hand comes up. Inhale. Left hand points up, right hand points down. I'm going to turn, bring that in. So I inhale. Here I'm going to keep I want to feel here my neck up. I want to feel my belly button and spine strong over my sacrum, over my heels, so that everything lines up, gives me good balance. Okay, from there. And from here, I'm going to grab like I have a ball, like a big beach ball. And as I lean forward, I have the beach ball and I come all the way down. Notice it's like head level. And as I'm going to come all the way down, and when I get here, I'm going to just make a little turn here, clasp the hand, bend the knee, curl, and come up. And let's do that again. Come down, sink onto the right, take a step. I want to make sure you can see. Come up, back down, and just into here. Now I'm going to sink onto this, take a step, come up, come back. Shoulder width, grab the ball, inhale. And exhale as we go down to where you're comfortable. And from here, I'm going to just turn my hands around, clasp, bend the knees, and curl up. That's the liver. And then the gallbladder, the husband of the liver. We are going to, this is called lean back and exhale, something like that. Anyways, this is the gallbladder. And from here, we're going to start, bring our hands, we're going to bring our weight a little bit forward as we come up, inhale. And then we're going to bring our hands as we lean back and exhale. Very good. And now as we turn our shoulders, we inhale and exhale, shoulders low, elbows low, and we're going to sink. Good posture. Keep that structure, pelvic tuck as you sink. And bring your hands to about the point known as gallbladder 33, right above the knee on the side. And then we're going to come up, massage the ribs. You come off the heel. And then we're going to come down as we massage down. And this time we're going to go below the knee to a point called gallbladder 34. And our middle finger should be touching. Good posture, a little bit of a squat as we come up and relax. One more time, gallbladder. So from here, we are going to lean forward just a little. Inhale. And lean back. Exhale. Rotate the shoulders. Inhale. And as we go down, exhale. Just sink into our heels. Don't lean forward to do this. Sink down. This way, if you can't get all the way down, just go here. That's fine. If you can, go down to about gallbladder 33. Then we're going to come up, massage the ribs. Heels off the floor. We're going to come down, and this time we're going to go to gallbladder 34, which is below the knee here. And then come up. And let's bring the thumb to the QiGong, wrap around the thumb, wrap around the fist. 3 breaths, in and out. Notice the numbness and tingling. It should feel really good. Buzzing, that's qi flowing down your arms and legs. Feel how relaxed you are. Feel how easy it is to breathe. Feel your sinuses have opened up. Feel how clear your brain is. Then we're going to just left, if you're a male, left hand. If you're a female, right hand. And then the other hand over 3 times clockwise on the dantian, 3 times counterclockwise. This seals our qi from leaking the qi we've gathered through practice. Relax. Thank you, guys.